Hello, I'm going to do my best to keep this short and sweet. This week we are looking at Asian Americans and Pacific Islanders. And I think that this population, probably more so than any other population, is less likely to seek mental health treatment. There is that stigma or that understanding that mental health could be considered a moral failing. It's not acceptable to have mental illness. With that thought, then you're less likely to seek help or support. It was also stated that they're less likely to engage in family therapy or going to group therapy sessions because they don't want to. They have that pride and that sense of strength that they want to carry on. There's also quite a bit of discrimination and stigma against the Asian population. Different things such as their educational levels, gender roles within the family, expectations both put on in the school setting and the home setting. There could be conflict between the roles. An example that the text referred to was an Asian female who is college level trying to pursue education and seek a career, but then also having that expectation at home, so kind of having those split lives, so to speak, of trying to maintain a home life and be respectful for the traditional expectations and gender roles that the family may have, but then also that kind of push to grow professionally and educationally. So those are things to consider when working with, and as far as approaches go, traditional therapeutic approaches or Western ideas may not be suited for this population. This is where bringing in the clients, where really getting a good understanding of where the client stands and what they believe and what they have found to be helpful, and allowing them to bring in their ideas. This might also, though, include challenging some unrealistic expectations they may have on themselves, or challenging some of the ideas that have come down through that hierarchy in the family, which traditionally in Asian families, the older men will hold a place of power, and the women are more put into that caretaker traditional role. So there is that conflict there, and there tends to be that expectation within the Asian families to stick it out, to be resilient and persistent, and that would entails a lot of stress, anxiety, and then just that constant expectation coming from all directions could lead to depression. But as mentioned in the text, depression is, for some in the Asian community, is considered a moral failing. And so to be able to provide a safe place for the client, to where they don't feel that judgment, they feel free to speak, they feel free to flow with with their emotions and how they feel, and be true to themselves. And then just kind of like pairing together maybe traditional Asian practices or approaches in more of a holistic viewpoint, and then bringing also in some of the Western ideas if suited. So yeah, this could be challenging, and as I had mentioned in one of my assignments, this is probably the population that I feel least comfortable working with, just because I don't have a lot of experience in working with Asian Americans in a counseling setting, and that speaks to the just kind of that stigma that they have put on to mental health diagnosis, and just trying to keep that pride in the family there. So I look forward to reading what you guys have to say about this, and any suggestions that you might have in working with this population, and how to be respectful to to both the family and cultural considerations, but then also helping the individual to grow and overcome some of those unrealistic expectations they may have put onto themselves. Thank you.